Congratulations, you have a new baby. How do you keep this thing alive? How do you keep this beautiful bundle of chubby joy healthy and happy, at least for the first couple of months? I'm going to give you some high yield tips that I personally think every new parent needs to know. So, I really mean this. This video could actually save your baby's life. And that is why I'm making this, because I've seen cases where babies have actually passed away because of lack of this advice. So I really hope this can help you and your family. And there's really nothing more tragic than a young infant or child dying. So if this is helpful for you, I'll be thrilled. And remember, there is this total terror of responsibility when there's new life given to us. And at the same time, I want to share with you what I tell my friends about fevers, sleep safety, biggest risks to avoid. And you know what? It's really hard to believe, but somehow babies can survive to age 3. And when you realize how many things could go wrong, sometimes it's really hard to believe. So here we go. This is educational information, not medical advice. And first of all, let's talk about fevers. You need to know when to call the doctor because it's very common for babies to have fevers. But remember, under 12 weeks old, under about 3 months old, any fever above 104 degrees or higher is considered something where you need medical attention. You need to get it checked out, even if it's nothing, even if it's just a tiny little virus, or maybe there's some other benign cause. Get it checked out because their ability to regulate their temperature and fight off infections is really not kicked in yet. And also now for any age of a baby or young child, above 104 degrees is considered something really past the threshold of safety. Or if there's a fever lasting for 3 or more days, or any 24 hours where you can't get the fever down. And remember, fever is actually an adaptive response that is healthy for your baby in small doses because the reason the body will go up in temperature is because it's trying to fight off whatever bug is in the body. And those bugs are supposed to die off at higher temperatures, and we're supposed to stay alive. So fever is not inherently bad. What's bad is when it gets too high, or when it's really high and your child cannot sleep or function or eat, and then things are going to spiral out of control. So you need to have a really good thermometer on hand, and you need to check this regularly. And then always pay attention to lethargy or overtiredness, fussiness. If the baby's hard to wake up, these are all very concerning signs, and you need to call the doctor, go to the hospital. Blue lips or tongue are a sign of lack of oxygen getting to the tissues, and the body parts will turn blue. So you need to call 911. Also, if there's a rash or a stiff neck, which could indicate some kind of infection in the nervous system, sore throat, ear pain, vomiting, and especially diarrhea, which often can cause rapid dehydration and babies can die from diarrhea. Remember, the worst thing that can happen if you go to the hospital or call your doctor is that somebody's going to be annoyed that you're a first-time parent and you're worried too much. But that's not a big deal. It's much better to have that annoyance versus your child possibly dying. So play it safe. Okay, next, when you have a fever in your baby, you need to know how to treat it because you can actually do more harm than good. So if it's a low-grade fever from 100 to 102, generally pediatricians will say, is the baby comfortable? Is the baby taking breast milk? Is the baby taking fluids? Are they sleeping? Are they doing other normal baby stuff? And generally they may not treat. But above 102 to 104, it's really about the baby's discomfort. You may give Tylenol. And then above 104, pretty much most pediatricians will always treat. These are not hard and fast rules. And of course, I'm not giving you medical advice, but these are just heuristics to think about. Rarely are you going to see a fever above 106, but that's definitely an emergency. Now remember, you never want to give aspirin. There's something called Rise syndrome. Babies should never get aspirin. People in their mind sometimes don't know the difference between aspirin and Tylenol. Aspirin is technically a blood thinner and does all kinds of other stuff. It's okay for adults, but not for babies. You don't want to put your baby in an ice bath or something like that, or you don't want to rub them down with alcohol, give them a cold sponge. These can paradoxically sometimes do more harm than good. Remember, fever is adaptive in low levels. So you don't want these rapid changes like just throwing the baby in a cold bath or something like that. And then also, Tylenol is fairly safe for young children as long as you keep it under the dose ranges where it's safe. So every 4 to 6 hours and not to exceed 4 doses per day using the weight of the baby and the dosing instructions on the label. Make sure you read those very carefully. Also, for Motrin, which is also called ibuprofen, you got to wait until the child is older than 6 months of age, or you get an okay from the pediatrician. Generally, you want to avoid Motrin, also known as ibuprofen, for young newborns. People often mistake Tylenol and Motrin. And really, the treatment here is going to be fluids like breast milk, formula, and water if the baby's over 6 months old. But can't go wrong with breast milk and formula to keep the baby hydrated. And remember, during fever, one of the biggest dangers is dehydration. So keep that little guy or girl drinking all the formula or breast milk they can. All right. And now, how do you tell if your baby's actually dehydrated? You should be able to look at your baby and tell, oh my gosh, things are getting worse, or no big deal. Yeah, that's the difference that you get from clinical training, but you should take this into your own hands. When the baby's crying, are they producing tears? You may think maybe they're not upset. But you know when your baby cries when tears are coming out or not. So you want to pay attention to that, because if there's no tears, it's not because they're stoic. It's because they're maybe dehydrated. And you want to actually measure the number of wet diapers per day in 24 hours, not 12 hours, not like daytime, but 24 hours. So generally, less than 3 to 4 wet diapers per day is too little for a newborn or a young baby. Typically, they're going to be higher than that, 6, 8, 10. And when they're having fewer diapers that are wet, that means their body is not excreting urine. And the reason is because there's not enough free fluid in the body. Sunken fontanelle, if you look at the top of the baby, the newborn, there's going to be this little spot that's indented. That's called a fontanelle spot. When there's adequate hydration, it's going to bulge, a normal bulge. And of course, when there's too much bulging, that can be a problem too. But generally, if there's a gentle bulge, that spot is going to be depressed or softer when it's dehydrated. So that's another sign. A dry mouth, you can actually inspect the child's little mouth and see how much saliva is in there and so on as compared to the baseline. Refusing feeds is a red flag. Babies should want to feed. Babies should want fluids and breast milk. All right. So sudden infant death syndrome is also a terrifying and among new parents, probably one of the most feared outcomes. So I really hope this helps you. The safe sleep rules seem really silly sometimes, but they're evidence-based. They've been shown in studies to actually correlate with less death. So always place the baby on the back to sleep. This is a big one. And remember, sometimes grandparents have their own way of thinking about things. Back in the day, we used to do this, we used to do that. A lot of this knowledge is really new. So all these evidence-based principles have only emerged over 5, 10, 15 years. So grandma and grandpa may not have had access to this kind of knowledge, or maybe there's cultural differences where people don't really read research as much, or they don't really think of evidence-based guidelines. So this is basically what we know from research. Place a baby on the back to sleep. And you might say, doesn't make sense to me, because what if the baby chokes on their spit? I don't know. This is just what the data shows. If you put the baby on their face, they're more likely to die of SIDS. And remember, the absolute risk is not very high. It's a tiny percentage of babies who die of SIDS. We're talking about relative risk, meaning even if the risk is really low, can we make it even lower? Number 2, no side sleeping or stomach sleeping. Apparently, this is a many hundred-fold increased risk of SIDS. Probably this is because they're breathing in carbon dioxide when they're putting their face down. And that can have a negative feedback loop into the respiratory system and can cause respiratory depression. That's one theory. Also, sometimes their lungs are not strong enough to keep breathing when they're on their stomach. So that's, if you take nothing else from this, just remember that. And babies suffocate much more. They can also die, like I mentioned, because they're rebreathing in air that they've exhaled, which has higher carbon dioxide. So the air you bring out of your mouth, every breath, has higher carbon dioxide than the air you breathe in. Why? Because the air you breathe in is coming from the fresh environment, and you're using up the oxygen, and you're breathing out the air you're no longer needing because you've extracted all the oxygen that you need. Babies do this too. So you got to watch out for that carbon dioxide buildup. Number 2, no loose bedding, pillows, or stuffed animals. And this is the tough one for a lot of people, because you want to give that newborn all these cute little bears and bunnies and monkeys and little pillows and cute bedding. But this is definitely a no-no. And many parents fight over this because one parent wants to put it in the crib and the other parent maybe heard of this rule and says, no, we can't do it. But trust me, you don't want this stuff in your crib if you're worried about SIDS. A swaddling blanket that can come unwrapped can cover your baby's face at night while you're passed out. That can increase the risk of suffocation as well. So even something as innocent as a swaddling blanket can contribute to a baby dying. And the same principle applies to bedding, pillows, stuffed animals. When the baby is sleeping, you want to put your child only in a crib or bassinet at the most. never in your own bed. So always on this firm, flat sleep surface. It seems almost Spartan and mean to put a baby down on this kind of minimal surface. Oh gosh, it's going to be so bad for its back. It's going to be uncomfortable. He or she's going to just feel like nobody loves them. Much better just to have a nice flat sleep surface than risk any of this SID stuff. You can save all those cute blankets and stuffed animals and bedding for later. In addition, sleeping in the bed is also something that many parents fight about because maybe it's a cultural thing or maybe it's like you want to cuddle with your child, but this also really is something you should avoid because when you're passed out, you can roll over onto your child. And that's just unbelievably sad. The child dies in that way. Or the blankets that you're using could cause the carbon dioxide to build up in your baby. So it's really not worth the cuddles. Just wait 6 months to a year. I would say a year, if ever. Using a pacifier for naps, for some reason, pacifiers have been associated with less SIDS risk. I don't know why that is. Maybe it makes the muscles of the throat stronger. I don't know. But you can practice using a pacifier for naps and bedtime, and this is a good practice. In addition, a cool room from 68 to 72 degrees should be something you talk about with your husband or wife or whoever is helping take care of your child. One theory behind this is that babies are much more likely to be in trouble with overheating than with being cold. And overheating could contribute to SIDS risk. So keep the room nice and cool. And one principle that helps is how many layers of clothing does my baby need? How many do you need? And then add one to that. That's often a good heuristic for how many your baby needs, depending on where you're living and what the temperature is like outside. And as I mentioned, heat is much more deadly for babies than cold. Everyone thinks, oh, my little baby's going to be so cold. I don't want it to be cold. That's really not as dangerous as overheating. They don't have the ability to cool themselves. Their thermoregulation systems are really not so well developed, whereas their shivering reflexes are well developed. So babies can shiver. Babies can heat themselves up because they have all kinds of fat that they can use. So keep that in mind too. That's a misconception. Now, in addition, there's a lot of products out there that say they can reduce the risk of SIDS, and they're mostly just ways that you throw money down the toilet. There's really not been anything that has rigorous evidence that's been shown to reduce SIDS, like these wedges or positioners, special mattresses, specialized sleep surfaces. These are mostly marketing ploys. There's no rigorous randomized control trials really showing these things work. So if someone asked me, I would say just don't use those. Keep it simple. Now, swaddling is really important. When you leave the hospital, you're probably going to have those blankets that every baby has. I don't know who's making all these blankets. They all look the same. But when you swaddle the baby, you need to eventually stop. And typically that's around 2 to 3 months old or when the baby starts rolling. Because what happens is the baby will sleep and then eventually baby will realize, wow, I can move. So it'll start rolling over. The risk there again is when the baby rolls over, it can get stuck on its stomach at night and that can cause death, SIDS type reaction. So you want to stop that around 2 to 3 months. And if they're stuck with face down, they can be unable to breathe. The other thing is you can put a wearable blanket like a sleep sack if they outgrow the swaddle at maybe 2 months, if you're worried about them being able to roll and if you're worried about them being cold, because then the baby gets the benefit of the swaddle type apparatus without the risk. And then again, always place baby on the back. No weighted swaddles. Some swaddles are weighted to keep the baby down, like put pressure on their chest or lungs. But this is the terrible idea. I don't know who makes these things, but that can also increase the risk of respiratory collapse and death. The hips should be loose. When you swaddle the baby, you need to make sure you don't bind the legs too tight because that can actually cause what's called hip dysplasia, hip damage and development. You can have these dislocations or dysplasias and they develop in the wrong way. You think you're keeping your baby nice and snug, but the hips need to have some looseness to them. You should be able to fit 2 to 3 fingers under the swaddle, and you can do that at the chest level. That's a nice test. And also remember, imagine if someone was swaddling you with that blanket. I think you would overheat pretty quick. So you got to really watch out for is there sweating on their forehead? Is their hair all wet? Are their cheeks getting flushed? This is kind of basic stuff that can really do damage. So you got to watch out for that. Heat rash, rapid breathing. Because rapid breathing is basically, I'm trying to cool myself down. Just like if you see maybe your puppy breathes rapidly when they go run. We all do that. But children and babies will do that too when they're overheating. The other thing is feeding is like this intimate time, but it can also be a deadly time. So you got to be able to feed the infant in the correct manner. And sometimes when babies are having a virus or a little cold, they are not able to breathe through their nose. So you want to first use some saline drops and suction right before the baby feeds so that you can get that nose cleared out. Because if they're going to have the breast in the mouth or the bottle, they're going to be breathing through their nose. So you don't want to cut off their oxygen while they're breathing. And that congestion can reduce their ability to feed. So the other thing is you can use steam from your bathroom shower, or you can use a humidifier to help break up some of that mucus to help them feed better. And also remember, you want to always feed the baby not totally flat. Some people put the baby flat on the ground and put the bottle or breast right into their mouth. That's tough for swallowing and for not choking. So incline is really important. In addition, like I mentioned, there's a choking and ear infection prevention thing here too, where the positioning matters. Not flat on the back. You can induce a higher risk of choking and ear infection if the bottle is placed directly into the mouth and the baby's flat on the back. The milk can run into the eustachian tubes in the ears, and this can prevent not only not choking, but the risk of ear infection goes up. Yes, a slight incline is very helpful for the baby, even though you might think the baby's not really comfortable, he or she needs to lie flat. The head has to always remain higher than the body. Because why? Gravity. You want gravity to take that milk and put it into the stomach. You don't want it to get stuck in the throat. And same thing at night. Dream feeding is safe if done inclined, so don't feel shy about that. Now, here's a recap just to remember, okay? I know it's hectic. There's a lot of things probably going on if you're a new parent. See a doctor if there's a fever in any baby under 3 months old, any fever, 104 and above. Remember to sleep on the back only, no exceptions. Hydration is really important. Watch and know those signs of dehydration. Safe swaddling is so important. And no soft bedding, no bumpers, no stuffed animals. So you got this. You're not alone. You'll get through it. And I wish you all the best. And if you found this helpful, please share with someone who you know has a baby or check out my free newsletter. Take care and to your health of your new family. Thank you.